Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up next in the Going Deep segment, brought to you by CO2 Lift in our Expert on the Microphone series. Today, we're joined by board-certified plastic surgeon, Dr. Ivona Percec. She is the Associate Director of Cosmetic Surgery and Assistant Professor of Surgery at Penn Medicine. Her love of science, art, and working with her hands naturally dovetailed into a career in plastic surgery, sculpting people's faces and bodies, where she has excelled for over a decade. She joins me today to discuss how she is transforming people's lives from aesthetic facial procedures to reconstructing survivors of female genital mutilation. Welcoming now to the show is the amazing Dr. Ivona Percec. Welcome, superstar.
Thank you very much. I'm very pleased to be here.
So excited to have you. You have quite the impressive resume, but before we dive in, let's look back to the beginning. I know you rotated through various medical specialties, but ultimately landed on plastic surgery and have been quoted saying finding plastic surgery was like coming home. And a facial surgery was one of the first operations you ever witnessed, an experience that really stuck with you. What initially drew you to the plastic surgery field, and how do you see aesthetic procedures ultimately transforming lives?
Great question. You're right. It was like coming home. And in fact, I come from a long line of scientists and artists in my family and academicians. And what I loved growing up was all of those things: science, art, aesthetics, fashion. And when I found medicine and the art of healing, all of those really put together defines plastic surgery. So you're looking at patients from a very holistic standpoint. You're looking at the outside, you're treating the outside and the inside. You're being artistic, meticulous, creative, and scientific.
Yeah. I mean, a lot of people view aesthetic surgery as fairly superficial. So I love that you highlight how it doesn't just change how you look, but also changes how you feel. And I know you've even talked about how aesthetic surgery has the ability to lower inflammation in the body, because if you feel good about how you look, it decreases your cortisol levels, which ultimately alters the rest of your anatomy and decreases the inflammatory process, which is just fascinating because it's just a domino effect, right? Now, for patients seeking plastic surgery procedures, only half the battle is the procedure, but the other half is recovering. And while recovery isn't necessarily easy, there are things providers can do to make it easier, if you will. And one of my favorites is CO2 Lift, which is non invasive, clinically proven, and medical grade carboxy gel that, I mean, not only offers the monotherapy benefits, but can significantly improve a patient's results and comfort post procedure. I'd love to know, doctor, how do you help your patients in the recovery process with products like CO2 Lift? And have you noticed measurable differences in recovery times or outcomes when patients implement these treatments post procedure?
Absolutely. I think what we've learned is preparation of the patient before the surgery and after the surgery is critical. And CO2 Lift to me has been an amazingly powerful approach to do that. It's easily tolerated. You put a mask on a couple of days before the procedure in the area that you're going to treat, and then you do the same immediately after the procedure and for a week or more afterwards. And it transforms people's tissues in a very simple way. And it's subtle but very, very powerful, and it's tolerated by everybody. And I think what we've come to learn is that you really have to think and be purposeful in preparing your mind and your body for the surgery. And that way you will have the maximum outcome.
I love that you said prepare your mind and your body. It's so important because it's just so connected, and it's like it's true. Mind over matter essentially is that's a perfect example. Now, you're also very well known for your work with survivors of female genital mutilation, also known as FGM, which defined by the World Health Organization comprises all procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. And more than 230 million girls and women today have undergone female genital mutilation in 30 countries in Africa, the Middle East, and Asia, where FGM is practiced. Now, I know your first genital mutilation patient came to you through a referral from a gynecologist, and no other surgeon would agree to take on the case. However, you, my dear, stepped up and actually created a new reconstructive procedure that has now helped numerous women increase sexual function and ultimately heal the emotional and psychological wounds associated with mutilation. Can you please tell us more about this FGM reconstructive surgery and why female health and wellness is so important to you as a whole?
Everything drove me, the misunderstanding under treatment of women, the fact that women were ashamed and shouldn't be for having gone this procedure, just like they might be ashamed of having a facelift, but this even more so because they didn't select to have this. They were traumatized, they were victims. And so the women who come to see me are trying to empower themselves to take that power back. And so it was a challenge. I saw it as my duty, as kind of the universe coming to me with the opportunity to create a meaningful change, something for good for a population of women who had suffered their entire lives with not just functional deficits like pain, but also with psychological deficits like trauma, depression, anxiety, all the other things that come along with that.
Wow. I mean, the work you're doing is so invaluable, and I'm so glad you took this on. Patients really are suffering all over the world, and you're very, very proactive. It really sets you on a path that not only added another avenue to your career, but also gives you such a meaningful purpose. It's so beautiful. Good job. Good job. I love what you're doing. Now, what are some of the most common vaginal surgeries you perform, and what concerns do women typically have when seeking these procedures? I know it's not an easy leap for any decision. It's not easy for anyone to make.
No, absolutely. And it's a hard topic to talk about, which I think is why people come to me because I'm very open and I'm very comfortable speaking about it. So I see a lot of women, both young and old, who come in for labiaplasty, which is mostly just a rejuvenation or a trimming of the inner lips of the vaginal region, or a clitoroplasty, which is a lifting or an exposure of the clitoris to make it function better and look better. We're all very sensitive to the face, the breasts, for example, and other parts of the body, but the vaginal region or the vulvar region is the last frontier. And I think we finally started to conquer it, both through the FGM work and that coming to light and women being able to take their power back and speak about it, but also just for things that are maybe not functional. And a labiaplasty can be functional in the sense that it could impair a woman from doing the exercises that she likes, from enjoying intimate moments in the way that she likes. And so it affects all of those components, and we can improve on all of them.
Yeah, yeah, great points. And I know CO2 Lift also has that vaginal rejuvenation gel product, CO2 Lift V. In your experience, what role do non-invasive treatments like the CO2 Lift V play in recovery and overall vaginal health?
They play a huge role in the recovery, especially as we're going through a phase where we're starting to talk about and be open about the menopausal changes and perimenopausal and premenopausal changes that women are undergoing. So the CO2V has been instrumental in helping women who are even non-surgical actually have a more robust sexual experience, less dryness, more comfort in those regions. But especially if they're undergoing surgery, the V-lift is really helpful with cutting down inflammation, bringing blood flow to the region, and allowing those women to heal a lot faster in an area that's normally very sensitive and can be traumatized with more invasive techniques.
So many great use cases this product has. I love it. And it's so simple and it's backed by science and clinically researched and verified. It's even been compared to a hyperbaric oxygen chamber by some of the top plastic surgeons. So I love this feedback. Now, in addition to your work in surgery, you also run the Percec Anti-Aging Lab, which you founded in 2010 to study how stem cells from fat tissue impact the aging process at various stages, as well as how those cells impact scar tissue formation and face and body rejuvenation. I think this is so important as younger generations are focusing more and more on preventative skincare, with many adopting proactive routines and seeking out specialized care early on before these problems arise. And with your research, you can work on delaying the aging process by intervening at the cellular level. How do you see the role of stem cells and regenerative medicine and natural anti-aging products like CO2 Lift shaping the future of plastic surgery and aesthetic treatments?
We're already seeing a lot of those functions coming to force in the patient treatment arena. For example, you might not be able to use stem cells directly. We use them indirectly a little bit in fat grafting. We know that when you transfer fat, it contains a high proportion of adipose stem cells. And so what happens is over the course of time, those stem cells help to rejuvenate the regions that you place them in. And I use that for all of my labiaplasty and my FGM reconstructions, my facelifts, for example. But something like exosomes, those are all coming to become very popular. And exosomes derived from stem cells contain very powerful nutrients that can be delivered either by injection or topically. And so the stem cells are really our reservoir of a new youthful molecules that have not undergone the aging process that non-stem cells have.
Wow, you're full of knowledge. I love this. This is all so fascinating to me, and I love that this generation is about preventative medicine and really studying the science. Recently, we had a researcher here, Dr. Serenia Wiles from the Mayo Clinic in Minnesota, and she's saying exactly what you're saying, that exosomes, regenerative medicine, being at the forefront of these new, researched, verified, and still, I mean, ongoing research, of course, needs to be done even deeper. But you're right. This is the new era, and it's no longer about overfilled lips or that overdone pillow face look. People are just opting for more natural, even with their breast augmentations, that they just want a more natural look or just a natural lift, right? So yeah, it's the industry is definitely changing.
And I think the biggest challenge we face, and I faced the challenge myself when I was running my lab and trying to get grants from the NIH, for example. No institution wants to fund something that they consider elective or superficial. And yet all of the patients, all of the people in this country and all over the world are using these treatments. So it's our duty as physicians, as scientists, to look at the effects of these treatments, to whether they're effective. Are they safe? How can we use them in the best way possible? And that's what we're doing with carboxylift, with exosomes, with stem cells. We have to do that kind of research. But it's really now the companies and private sources that are funding the research. And we have to move forward because the public wants that information.
Yeah, yeah. Well, I'm so glad you said that, and I'm so glad we had you on. I love our experts on the microphone, and you fit the check. You fit the every single check mark perfectly. Thank you so much for shedding so much light and information. That was our Going Deep segment brought to you by CO2 Lift, and that was the incredible board-certified plastic surgeon, Dr. Ivona Percec. Definitely head to pennmedicine.org to learn more about her and her life-changing services. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2 Lift, ask your skincare professional or go to co2lift.com.